In this video, we will be using several anatomical terms to describe movements or positions in the asanas. One basic term or concept is the idea of natural spinal curves. We have natural curves that include the lumbar, thoracic, and cervical curves. The lumbar curve is slightly rounded forward. The thoracic curve rounds out to the back, and the cervical curve rounds forward a bit in the neck. Everyone has these curves, and all of our curves are slightly different, so we can't just compare our curves to someone else's curves when evaluating our posture. When we are standing, we should feel a gentle lift through the spine that makes us taller. Feel a softness at the back of the knees, and our pelvis should be balanced. That is, neither tip too far forward or backward. It should feel secure and allow us to lift our spine up without much effort from the pelvis. Some points of reference for posture are the tip of the ear, the point of the shoulder, the outside point of the hip, the middle of the knee, and the outside bone of the ankle. These should line up when we stand upright and maintain our natural curves. If they don't line up, with patience and practice, you may notice improvement. When these points do line up, tension is minimized in the muscles and the joints. When we bend forward, we are not rounding the spine forward. We are bending at the hips and sometimes softening or bending the knees. This maintains our natural spinal curves. By keeping the spine in this position, we strengthen it and protect the bones, joints, and discs in our spine from too much strain. It is also very important with osteoporosis not to bend forward in the spine. This places too much stress on the bones in the front of the spine. Twisting is also not recommended for many spinal injuries, including osteoporosis. You should never feel pain anywhere in your spine or other joints during yoga. Other anatomical landmarks that we address are the shoulder blades or scapula, the pubic bone, the sits bone, and the pelvic floor or pelvic sling muscles. During yoga, and also when trying to find our best posture, we want the shoulder blades back and down. This is supportive of the whole upper body and arms and opens up the front of the chest, allowing us to breathe efficiently and keep the muscles in our neck and upper back more relaxed. The pubic bone is that bone you can feel at the very base of your abdomen. Moving it moves the whole pelvis, which has an effect on the spine. You will hear me mention it during several of the asanas. The sits bones are those bones you can feel when you press in at the base of your buttocks muscles. Moving them also moves the pelvis and again has an effect on the spine. The pelvic floor muscles are those muscles you feel if you visualize stopping the flow of your urine. When the muscles are relaxed, they do actually hang like a sling. With effort to contract them, they rise and the sling flattens. This motion, when done regularly, can be strengthening, helping us to control leaking urine. In medical language, they are known as Kegel exercises, and worth asking your healthcare provider about. This is a very brief anatomy discussion. There is so much more to know and explore. And exploring our posture can be complex. It can be difficult to lift our spine, strengthen our awareness of our natural curves, and stay relaxed at the same time. But the results are worth it. With our spine long and our natural curves stable, our spine is protected and provides us a sense of balance and harmony in the muscles of the body. Additionally, and more importantly, this good posture contributes toward the raising of our consciousness and upward flow of life force. These benefits make us feel better, more energetic, and helps us develop and project a beauty and wisdom that can come during this transitional time, this gateway to positive change, menopause.